My name is Phil Downer. I work at Orthopedic Specialists of Seattle. We're a division of Alliance surgeons. I'm an orthopedic surgeon. I have a special interest and focus in hip surgery, hip replacement, hip preservation, and I've been doing this now in this community for over 20 years now. I cover the full breadth of hip surgery, so any type of hip surgery I trained in and I'm comfortable with. So that goes the full gamut, the full age gamut. I only treat adults. I only treat patients who are skeletally mature. And so I'm dealing and seeing things like hip impingement with labral tears. I see patients who have suffered problems related to sports injuries or overuse type injuries, sometimes traumatic events, although those are less common in my practice. I see patients who have had hip problems for some time, or maybe didn't realize they had hip problems, and they have, and then have gone on to develop more degenerative type problems, arthritis of the hip. And so then I also treat patients for this with different types of hip replacement, and occasionally then treat patients who have had problems with their hip replacement and do hip revisions as well. So it's the entire breadth of hip surgery. I started my training medical school in Newfoundland. I went to McGill then and trained under some great surgeons there. I learned the full breadth of orthopedics, but I had some quite exceptional training in spine surgery, joint reconstruction, trauma. We did a lot of trauma at McGill. And then I had a special interest in hip surgery. And my boss at the time was from Switzerland, had trained in Bern at the University Hospital in Bern. And he enabled me I applied and got the ability to work in Bern, Switzerland, under what was then called, I think it still is, the Mueller Fellowship. Maurice Mueller was a very influential person in orthopedics in many areas, but especially hip surgery. And so I did his fellowship in Bern for a year and had a tremendous experience there, learned a lot, and took those things and now apply them to my work here in Seattle. I have focused my work in hip surgery over the years. And the reason is it combines a lot of the things that I'm better at. I love surgery. I love the operating room. I love everything about it. The hip surgery is one of those areas that's very reliant on three-dimensional spacing, three-dimensional orientation, being able to visualize things from one perspective and understand things deeper and to the sides and so on. Anatomy plays a massive role in all of these areas of orthopedics, but I think in hip surgery in particular, because the hip is a very deep joint. It's very central in the body. It's a very powerful, the bones are larger, the muscles are larger. There are a number of very, very important structures surrounding the hip that need to be avoided, obviously, when doing these surgeries. And so it's a very technical area of orthopedics. And the amazing thing about some of these invasive procedures of the hip is the changes that can be brought about. You know, you can make some incredible differences from how people start off to when they're recovered. And that's extremely satisfying to do such an invasive, big procedure with somebody. It takes a tremendous amount of trust, obviously, for these folks. But to do these invasive things and take people from one place where they're in significant discomfort and pain and take them to where they can function at a much higher level is very, very satisfying. I've come to appreciate it more and more over the years that, even though I do the same things quite frequently and have done for the past 20 years, my sort of amazement at people, what they get out of it and what they accomplish with it it's become more and more fun over the years.